is Dennis Briordy, and I'm currently retired from New York City Police Department. I first came in 2008, and my complaint was I was having issues with sinusitis and with sleep apnea. I was referred to Dr. Liberatore through Lenox Hill Hospital, which has a fabulous ENT program, and as a result of the program, they recommended her to help me out with my sleep apnea and some of the issues I was dealing with. I seen the sleep apnea starting to affect me more as I aged. The health issues related to sleep apnea was always a concern for me as you read more and more about the damages it caused later in life. I knew I had issues with my sinuses, I had a deviated septum, so when I came in to see Dr. Liberatore about the sleep apnea, as it was progressing, she kind of looked at it from a holistic standpoint of maybe we shouldn't just attack the sleep apnea while you're here, maybe we should try to clear everything up and work on the sinus, the deviated septum, the sleep apnea, and give you a better quality of life as a result of addressing everything. You had a very personalized feeling when you got here, from the receptionist through to the nurses and then straight up to Dr. Liberatore. Everybody individually dealt with you, sometimes down to the smallest things of referring to you by your name. So they make a huge effort, let it be from the ambiance of the building to the personal care and interaction with you, to make sure that you feel like you're an individual and you're the number one person most important to them. I mean, Lenox Hill Hospital and the facility was wonderful. I didn't have any long waits. There wasn't any great delays. They expected me when I came in. You know, Dr. Liberatore, again, you know, she's just that personalized touch. It carries through in everything she does. Even when I'm in the room before we're going to go in for surgery, she comes in, and it's not just to stop in and you know, tapping you on the toe to let you know she was there, so she can say she got there. She actually stops and you have a real conversation with her, and you can see that she knows who you are when she's talking to you. She's not like sometimes when you deal with surgeons, you're just another person that they're working on because of the volume that they have to deal with. Nothing bad about them, they just deal with volume and they don't have a chance to personally connect, or maybe choose not to. She chooses to, and that shows through. In the end, the benefits that I get from it coming out the other side, the quality of sleep better, obviously as we talked about earlier, the quality of life for me related to all those things with sleep apnea should have gone away. I think I'm better off now than I was when I first walked through the door, and I think that's a great measure of any kind of service you get, let it be medical service or any other kind of service in life. If you walk out and it's better in the end than you were before you came in, then you're ahead of the game. And I'm clearly ahead of the game after having the experience with Dr. Liberatore. No surgery should be taken lightly. But again, the benefits that I received from it would say that if your situation warranted, you should definitely consider it. And if you were considering it, you couldn't go to a better place than with Dr. Liberatore and the people here at Lexington ENT, because again, they put you at ease about doing a surgery like this. I know I would have felt more apprehensive if I was in a larger, more clinical area where I didn't feel a connection. But I felt like the staff here at Dr. Liberatore had my best interest at heart the full way as it went along. I wasn't just a folder or a number, which makes it a lot easier when you go forward a kind of surgery like this to feel that other people are looking out for you, especially people with the expertise in the area. Because of the sleep apnea being, I guess, addressed the best it could, I'm getting a better quality sleep, which doesn't make me as tired and lethargic during the day. So I feel a difference there as far as it. But I guess it's the longevity of life. The fact that hopefully with all this affected, I won't have a case of sleep apnea affecting possible future heart disease or any other issues, complications that it could cause for me later in life. So it'll allow me to live a large, fulfilling life.